when the Affordable Care Act, known as Obamacare, was passed, one of the provisions requires that hospitals do a community needs assessment. Now, that might be complicated for some hospitals, but actually not for us. And thanks to our great partnership with you all, I think we've been able to do it and are going to try to help other Brooklyn hospitals do. We were really approached by elected officials, other developers, and were sort of who tried to persuade us to get into what was going on at Litch so that we could be helpful. But running the emergency room at Long Island College Hospital is a bigger lift than we could probably sustain. And so we deferred doing anything until we found out that the other health members of the health team were very competent, very experienced, and very decent when it comes to listening to community groups and trying to provide decent health care, acknowledging the limits on resources available. And so we are, in fact, as you may have read, in discussions with SUNY. There are a lot of unanswered questions, and we're really not able, because we don't really know, to say what the package of healthcare services there on in the Litch neighborhood is actually going to be, other than what is in the proposal right now. But I can tell you one thing, that Maimonides' role in working on this endeavor is to start by conducting a health needs assessment, looking at data, and then, as Kalpana points out, having focus groups all over that area, from Red Hook to Wyckoff Gardens to people in Cobble Hill and Brooklyn Heights, all over, to get people's stories about what they think they need and what some of the problems have been, so we can account for that in our plan. I say our, I mean the healthcare team, in our future plans for putting medical services at Litch, on the Litch campus. I think things are sort of heating up around this, and the reason I think that is because SUNY has announced that it is leaving the Litch site on the 22nd of May, which is not very far from now. And so it seems like decisions are going to have to get made. That's above my pay grade. But I know that the mayor and the governor's office and SUNY have had, and local elected officials have had many conversations about this. And I believe that we will be seeing a direction sooner than later. Believe me, our board is very adamant about the importance of making sure that Maimonides remains the most viable, important hospital in the borough of Brooklyn. Not only do we do, like Star Wars, amazing clinical care, but we do it with a sense that our community partnership underlies the values and principles that we use to guide us in our work. So I think that's really about all I can say. If things progress and we end up undertaking more, and I can't predict that yet, you can be sure that we will have another meeting. We will not be going off and doing anything without conversations with you all. We're going to be having a number of town hall meetings for the staff, the doctors, the nurses, and other staff who work at Maimonides. And we will continue working with all of you and with our 50, maybe now it's almost 70 partners in community-based organizations in Borough Park, Flatbush, Bensonhurst, Bay Ridge, don't make me recite, are ironically sort of adversely affected. I'll give you one example. The Affordable Care Act. The Affordable Care Act intends to reduce care to hospitals for indigent people, people without insurance, and people who would otherwise be eligible for Medicaid, because the theory is that the Affordable Care Act will insure those people. And that works in states where a lot of people are left out of the Medicaid program because you have to be very, very poor to get Medicaid. Well, in New York State, you haven't had to be that poor. And so when the first period came to implement the law, Maimonides Medical Center was among a handful of hospitals in the country to lose the most money proportionately of our Medicaid reimbursement directed to taking care of low-income people. We don't get any more money to make up for it, but money that we've been getting from the federal government since the mid-'80s is gone. So that's a problem. We're hoping that people who have not yet been eligible for Medicaid or haven't tried to get it, and other low-income people will sign up in one of the health exchanges, but even that is problematic since medical insurance through the health exchange is not cheap. Not cheap at all, cheaper, but not cheap enough. And so people, ordinary people, opt to choose the insurance policy that is the least costly and agree to pay high deductibles when they get sick. And people get sick, and they intend to pay the high deductibles, but if they're sick and they're not working, they don't pay. And I will say that the bad debt number at Maimonides has been steadily rising over the last couple of years. Decent people, people who don't want to not pay their bills, but they just can't. And that is another challenge. We'd have to have a separate session to describe to you all the unintended consequences of the Affordable Care Act, but I'm glad you asked the question.